Optimize the patient experience. How to gain desired results through digital technology. My name is Marilyn Cox, and I am the Marketing Principal with the Oracle Marketing Cloud's Industry Solutions Center of Excellence. And I've included my contact information here. If you have any questions about any of the best practices or use cases defined, please feel free to reach out. I am certainly happy to chat more. So, awareness and recognition, presentation and diagnosis, treatment selection, brand selection and access, switching and persistency, those are the phases of the patient journey as practiced by many companies. And it's certainly a good patient-centric journey to follow, but you have to ask, is there something missing? According to the Industry Health Check from 2014 report, 85% of respondents agree that patient centricity is the best route to future profitability. And many companies are adjusting their strategy to focus on that patient journey. Through mobile applications, patient portals, and medication adherence programs, healthcare is working to provide content and services that guide the patient through that journey. But it's important to remember that each patient is unique in how their condition changes over time. And healthcare must communicate to the patient the right information at the right stage of the patient journey. They have to align with the patient, but also with the patient experience. So I'm going to tell you a personal story. My husband actually had double hernia surgery last summer. And of course, while I'm sure he's thrilled that I'm sharing that information, his experience was a fascinating in-the-field research study for me. Once his surgery was scheduled, all of his pre-surgical paperwork and registration occurred online a week before the procedure. The payer coverage was confirmed, data was captured, and medical history was documented. And then the morning of the surgery, we arrived at the hospital and were taken right back to the pre-op room where pre-op procedures began. With the exception of a few verification questions, no additional paperwork was required, and everything in the hospital system was accurate and up to date. As they administered his IV and took his vitals, a video played on the large TV in his room explaining the procedure, the process of administering the anesthesia, and what to expect after recovery. After he was wheeled back, I could order his prescription from the same TV and have it delivered to his room. Throughout the procedure, I would receive calls to my cell from the surgery staff providing updates. I could also watch a screen that would provide a status update using a patient code of where he was in pre-surgery, prep, operations, recovery, and post-op. And then once released, we received discharge instructions in paper form that were also available on the portal. Over the next few days, my husband could log onto the portal, see his test results, and also post questions to his surgeon for follow-up. But what happened is that communications began to break up. That's where that seamless patient experience for us ended. Because once we left the hospital, all proactive communications ended. My husband had a series of side effects, but when he posted his question to the portal, he never heard back. His test results were never actually posted to the portal. He found out the results a week and a half later at a follow-up appointment. And at the follow-up appointment, there were no FAQs provided or a physician discussion guide offered to help him get the most out of that visit. Like most experiences, communication tends to falter in the post-discharge process. Healthcare organizations recognize that they must focus on the entire care management lifecycle. And to do this, they must target communications around healthcare offerings. As an example, a company started a marketing campaign to target women ages 30 to 50 for their cosmetic procedures. And then shortly after the campaign launched, the company realized a better target for their procedure is males over the age of 65. Organizations must also extend this lifestyle focus and care management content across multiple channels. Google Think surveys found that 76% of patients were using hospital websites for research, compared to 32% using TV, 20% using magazines, and 18% using newspapers. Of patients who found physicians in private practices on their mobile devices, 44% scheduled an appointment. Year over year, the number of consumers using mobile devices to search for healthcare services increased by 22%. And 52% of smartphone users gather health-related information on their phones. It's imperative that healthcare organizations understand what content should be delivered to each audience segment and across the appropriate channel. And this is a quote that I love, one that I documented at an event that I attended. And Darren Rogers, the SVP and CMO of Healthcare Services Corporation, stated, "Not responding to a social post is like not answering the phone. Some of our biggest mistakes were underestimating the volume as well as the commitment around the activity required. Develop a digital scorecard, measure engagement, evaluate the volume and response, begin to understand the sentiment around both your organization and your competitors." And that was advice given specifically to healthcare organizations considering social media programs, and I think it's an excellent one to remember. One industry is starting to improve on this overall experience, and so I'd like to actually make a connection between what needs to occur within the healthcare industry and what I'm seeing occur within the sports entertainment space. So sports entertainment has developed a focus on the driveway-to-driveway fan experience. This is the experience a fan has from the time they leave their home to their time spent at the stadium to their return home. Sports teams are driving engagement with fans through communications focused on a fan's favorite player, favorite opponent, birthday, or other personal data. And by leveraging the data on the fan, these sports teams can send targeted promotions via SMS before the fan leaves for the game. Once at the game, the stadium can send push communications based on personal preferences, stadium purchases, and game activity. As the fan leaves the stadium, follow-up communications, surveys, offers, and game highlights can be shared with the fan through email, social media, and SMS. Many sports teams have noticed a marked improvement in ticket purchases, season ticket subscription renewals, and NPS improvements. Creating that same driveway-to-driveway experience in healthcare is very important. In my situation, the hospital got the pre-surgery and procedure communications right, but they should have focused on the entire driveway-to-driveway experience. Noting that my husband has a history of adverse reactions to anesthesia could have triggered a follow-up email about possible side effects like back pain. Having a nurse call that evening or the next day could have alleviated concern over pain and side effects of the pain medication. Responding to the posted questions on the patient portal could have eliminated inbound calls to the nurse team and unnecessary follow-up visits. While the hospital isn't looking for us to be returning guests, they are concerned with readmittance rates that can result in an improper post-op care, and the hospital does care about patient satisfaction scores, NPS, and developing advocates that can result in referrals and donations. Through a driveway-to-driveway program, hospitals can generate their desired results, and patients can experience the continued care and follow-up required after leaving the hospital.